friends, welcome to YouTube channel Health Cube, the place where my mission is to motivate you to look at the brighter side of the health. In today's video, I'm going to tell you some of the steps or else some of the preventive measures that you can take as a parents for your child who are suffering from cerebral palsy in order to minimize or else reduce spasticity. So if you want to know about this, make sure to watch this video till the end. Let's begin. Spasticity. One of the major concern and one of the major area of work or else focus when it comes to management of CP child. Spasticity is nothing but an abnormal muscle tone which is present mostly in the kids who are having some neurological deficit, which can happen before birth, during birth or after birth. But do you know that when it comes to management or else prevention of spasticity, you as a parent play a very crucial role. The reason being, you spend much more time with your child compared to a therapist whom you must be seeing at least 1 or else maximum 2 hours a day. Spasticity management is a long-term management protocol. And this is not just a treatment or as in therapy which has to be done for a small period of time and just left, but managing spasticity is more about strategic modification that you make in the lifestyle of your child so that it becomes a part and parcel of your day-to-day lifestyle. So, spasticity management first starts with understanding what exactly is spasticity and why does spasticity happens. Understanding of this particular information will help you to take some strategic measures in your day-to-day life in order to minimize that level of spasticity in your child. So, spasticity is nothing but increase in muscle tension. Now, we all as a human beings have certain level of muscle tension which is present. The muscle tone is controlled by the nerve cells which are called as alpha motor neurons, which are released or else which are starting from the spinal cord. And there is a balance that is between this alpha motor neuron as well as the brain centers which maintains this normal muscle tone. There are two muscle forces that make sure that our body is in equilibrium and we are in a normal muscle tone. The one mechanism of control is called as excitatory mechanism. This mechanism is nothing but the impulses or is the sensation that goes from the nerves that are present on the limbs to your brain. This information that goes from the hand to your brain gives command to your brain that a movement needs to be done. These impulses originate from the muscles and then they enter into the spinal cord, and sometimes there is a release of the command from spinal cord itself, and if there is requirement of some further mental processing, then this information also goes to the higher center for the brain to process the information that the nerves have carried with themselves. Now, on the contrary, in the inhibitory response, once the brain receives the message about the movement through the excitatory mechanism, then the brain activates certain areas and inhibits certain points or certain muscles and allows some movement to happen. Now, a simple example of this is that when we are trying to move our hand from down to up, at that time there are two muscle groups working. One is the front muscle group and another is the back muscle group. Now, if there is an object that is there in front and if I am wishing to pick that object, my eyes as well as my hand nerves sends the signal to the brain that okay, this girl needs to pick up this ball. At that time, the brain center processes and gives this information of contraction of certain group of muscles as well as relaxation of the opposite group of muscles. Hence, when I'm raising my hand straight, at that time my back hand muscles are activated since they are agonist of movement, but at the same time my brain inhibits the contraction in the front elbow region. So the simultaneous combination of contraction of one group of muscle and relaxation of one group of muscle is an equilibrium which has to be maintained and which is maintained by our brain. Now, unfortunately, in cerebral palsy, due to damage to the brain or as the higher centers, the inhibitory mechanism or as the brain centers are not able to send enough impulses to the brain, to the muscles which needs to be relaxed. That's why both group of muscles simultaneously gets excited and the movements become jerky, more hard and more strong. And this is shown as an increased muscle tone. Child will experience symptoms like velocity dependent increase in muscle tone, which means when a movement is done for a repeated period of time, as the repetitions increases, the tone of the muscle also increases, or as the spasticity also increases. Second, there would be always certain level of resistance which would be experienced in the movement. A child who is spastic, you will see that the movements are not smooth. You will feel some sort of resistance and you are not able to freely move the joint of your child. Definitely, there is also muscle weakness. As these muscles are not able to function in proper way, these muscles gradually becomes weak. There is hyperreflexia, which means the tendons of the muscles are overactive, and you will see that even slight amount of movement or contraction will lead to increased impulses. And sometimes there is clonus. Clonus means shaky legs, which is very commonly seen in cerebral palsy kids. Now, as I mentioned that spasticity leads to a lot of problem, but spasticity is not something which needs to be managed always. Spasticity sometimes can be helpful also for a child who is having more muscular weakness. This increased tension can sometimes be used as a helpful aid to allow movements to happen. Hence, spasticity only needs to be managed when it affects the ability of the child to function his day-to-day task. That's the reason it's very important that the child should go for frequent assessment from the therapist in order to identify to what extent the spasticity is existing and how much limitations are happening because of the spasticity. Basis that only spasticity management should be further decided. There are many kids who will have more floppy or else weak muscles compared to spasticity. That time, the spasticity is an helpful tool for allowing these weak muscles to move. But there are few scenarios as well where the spasticity is so extreme that it limits the movement or else ability of the child to move. At that time, spasticity needs extra care, extra attention. As I previously mentioned, as a parent, you play a very crucial role in preventing and minimizing the level of spasticity compared to physiotherapists. Reason being, you spend a lot of time with your child. You know your child much more than us, and that's why this strength has to be used in order to minimize the spasticity and also to come up with the strategies with which the child can be as independent as possible. Now, definitely, when your child is experiencing spasticity, there are few situations or else conditions due to which the spasticity will increase. The first and the foremost thing is to identify those underlying cause of spasticity. Sometimes the spasticity can be increased because of some inner causes like presence of constipation. If your child is staying constantly constipated, he will have higher spasticity rate. If your child has fallen sick or ill, at that time also the body would be more spastic. If your child have the tendency to get epilepsy attacks, at that time also few days post attacks the spasticity would be more. And if the child is having disturbed sleep, then also the spasticity would be more in the child. And if the child has got some sort of injury due to which he is experiencing pain, then this pain will also lead to increase in spasticity. So these were some internal factors that could lead to increase in spasticity. Now let's talk about some external factors. There are many external factors that could lead to increase in spasticity. One such example is loud noise. Whenever a child experiences very loud noise or some uncomfortable situation, crowded places, at those situations the child won't be able to stay relaxed and his spasticity will increase. The next thing is extreme temperatures. When you are traveling or else at home also, if the weather is either too chilly, too cold or else extreme hot, then the chances are that your child will show increase in muscle tone. Apart from that, uncomfortable posture also leads to increase in muscle tone. Many a times you would have experienced that when you make your child to stand, he leans backwards or else he try to lean somewhere. The reason being, this position is not comfortable for the child. Hence, whenever the positioning is adopted, always make sure that you use some assistive tools that reduces the stress or is the effort that child has to put to maintain that position so that he can stay relaxed to a maximum point. And that's the reason standing frames are one very important and good way in order to allow the child to stand in an optimal position, on the contrary, where he tries to hold something and stand. Because at that time, the child has fear of fall, fear of balance, and what happens is this all fear leads to increase in spasticity. Even if the child is sleeping on a bed which is too soft, or sitting on a chair or sofa which has got very soft bedding, at that time also spasticity will increase, because the soft beddings not brings relaxation but brings the sense of sinking down and lack of balance. This feeling or a sense of lack of balance leads to increase in muscle tone, and even tight clothing can lead to increase in muscle tone in the child. Hence, as a parent, you have to find out some. Hence, as a parents, you have to first learn to identify what is the root cause. What is the root cause of increase of spasticity in your child? Either it is some internal problem or is an external problem. Try to work on figuring out some solutions to these problems that is causing increase in spasticity. As you identify the root cause of your spasticity, then you can come up with solutions to minimize that spasticity level. Remember, relaxation plays a very crucial role when it comes to spasticity management, and you have to find ways and tricks in order to reduce or else maintain your child in relaxed state. As I always say, management of spasticity is not just one-time treatment but is a way of life. Management ways usually comprises of first identifying the cause of spasticity and trying to remove that particular cause. Secondly, stretching plays a very crucial role in managing spasticity. As with regular stretching exercises, what happens is you elongate or is lengthen the tight muscle, which gives or is allow these muscle to stay in a relaxed position for a long period of time. Make sure that in CP cases, the stretching has to be maintained for a brief period of time, say 3 hours or 6 hours. Hence, that time you need to take help of some special aids like ankle foot orthosis, cast, braces, etc. in order to maintain that stretch position for a long period of time. And third important way to minimize spasticity is giving adequate postural support. Remember this, your child doesn't have the ability to support his body on his own. It's not the stubbornness in the child that he's not trying to hold the position for long. It's not the fear of fall that is making him go down. There is definitely a problem which is there in the muscles which increases this fear. Hence, giving some good support in different areas where the muscles are weak allows the child to relax himself and try to come to a better position. And that's why postural support and postural support strategies are very important. In upcoming videos, I will be talking more about these postural support strategies in order to help you out to minimize this spasticity and to make your child as much independent as possible. That's why I have one request for you. Please subscribe to this channel and press that bell icon so that you will get notified every single time I will upload a new video. So stay tuned with me on these series of videos on HealthQ channel. I'll see you in another video. Thank you.